We've discussed already that probiotics may reduce inflammation. If there are imbalances in the gut, this may co-occur with leakage. And on the other side, the immune system is called to respond to that. So we know that in these gut syndromes like IBS, IBD, leaky gut, there can be, not guaranteed to be, but there can be increased inflammation. And that's what was interesting about this 2023 umbrella meta-analysis, which will be a touch more comprehensive than just your standard meta-analysis, as good as those are anyway, summarizing 39 randomized control trials, administering, as you can imagine, across 39 trials, different probiotics. There was blends of lactobacillus and bifidobacterium. There was the healthy fungus we've discussed before, Saccharomyces. There was also a soil-based formula or formulas using bacillus. The dosages ranged from 2 billion CFU per day to 100 billion CFU per day. They found that probiotics improved multiple inflammatory markers, including C-reactive protein, TNF-alpha, and interleukin-6. Additionally, they found the most effective protocol, and by the way, it's exciting to start seeing these papers hone in on what the most effective protocols are when they examine the protocols used, as in this case, in 39 different randomized control trials. Most effective dose, 10 to 100 billion CFU per day. Most effective duration, longer than 2 to 3 months. And just to echo, as we lower inflammation, it's not surprising to see improvements in things like maybe pain or autoimmunity. But I care most about outcomes. It's interesting to see, as we just covered, reductions in CRP, reductions in TNF, reductions in IL-6. But if you had those changes on your labs and you still had joint pain or depression, you probably wouldn't be thrilled. So interesting what happens mechanistically. Most important, what happens regarding the clinical endpoints. I'm less depressed, I'm less fatigued, I have less bloating, I have less diarrhea, etc. This next study, I think, was also relevant, looking at autoimmunity. Quick primer here. Autoimmunity may originate in the gut because of the high density of immune cells in your small intestine. About 70% of your immune system is located in your small intestine. And if there's leakage, this triggers the immune system, and this can be an initiating factor for autoimmunity. I want to be really careful to say, we should be cautious not to paint the scenario that all autoimmunity starts in the gut. And as much of a gut health enthusiast I am, it's still important to clarify gut health and your gut will not be culpable for all autoimmunity. With that, let's go into the clinical trial here. 40 patients with multiple sclerosis were given either probiotic or placebo. The probiotic was Saccharomyces boulardii, this healthy fungus we've discussed before, 5 billion CFU per day. What do they find? Reductions in C-reactive protein, more importantly, in my view, reductions in pain and improvements in fatigue. This is a good transition to a meta-analysis because we just covered one randomized control trial. What about looking at a meta-analysis? Again, trying to get a broader view on the body of data regarding probiotics and their potential ability to improve joint pain and inflammation. This meta-analysis summarized 11 randomized control trials. People were given either a placebo, a prebiotic, or a blend of prebiotic and probiotic. And again, they're using different types of probiotics, whether it be our traditional lactobacillus and bifidobacterium type, or maybe even a soil-based probiotic, including Bacillus coagulans species. Coming to their findings, they found that either probiotics or a combination of probiotics and prebiotics all improved rheumatoid arthritis symptom severity and inflammatory markers like C-reactive protein and interleukin-1 beta.